And hello, this is Expect More with Dr. Andrea. And today, my very famous, very fun, and uber intelligent guest is a good friend of mine based in Las Vegas, Nevada, Dr. Danielle Mills. Mostly because my friend here has two doctorates, not one, not to be outdone, has two. Danielle, thank you so much for coming. Let's talk about this because I have to read it because I don't want to embarrass myself. Productive versus unproductive struggle and the growth mindset, which we're all about here, really, in leadership, and navigating leadership and embracing emotional regulation and neuroplasticity. It's a whole mouthful and I understand it, but I can't wait for you to articulate it better. But first, can you just tell us a little bit about your background? Maybe not so much about how we know each other because that gets complicated, but your background and how you got to the seat that you're sitting in now.
Sure. Well, thanks for inviting me today. My background is I was a physical therapist by profession, and I got to my current college, Carrington College, for being the director of clinical education for their PTA program. I then transitioned to be the program director of that program and worked my way up to dean of curriculum, where I had a set of programs that I managed across the college. And then for the last, I think, 5 years, I've been the vice provost of academic affairs. I manage everything curriculum, new program development, and programmatic accreditation.
Yes, that's
Yes.
we've talked multiple times and my mind every time I talk to you, I don't know how you keep all of that in your head on top of you had a very productive clinical career as well in physical therapy and then made that transition into academics. How was that, like a difficult switch for you or were you excited to do that?
So I was pretty excited to do that. And I really, you come into situations with your own perspective.
Mhm.
And thankfully, I'm always open to learn. I'm definitely a lifelong learner. And I came in with a certain preset of thoughts and realized that I was wrong. Those presets were wrong about how,
Wait, what? You
yes,
were wrong?
yes,
No. I don't
I
believe
was
it.
wrong. But I I do embrace change. I love change. I love innovation, and that just opened up a whole new world for me and a different way to connect with students. And
Mhm.
in my mind, in the DCE and PD position, to be able to ultimately help patients better.
Well, because I mean, if you think of it from like I sit more of an administrative seat now than a clinical seat, but a clinical seat for 25 years, and you are at the ground floor of what's being produced
Mhm,
out. So we've talked a lot over the last, at least definitely over the last 5 years, about what we would refer to as a surface treatment, right? For the most
yes.
part, we're like not digging in. And you were like, I know, I'm trying to tell these guys in class and I'm trying to get the curriculum updated so that they come out a little bit more realistic, really, right? That was part
Yeah,
of it.
for sure. I always talk to students. I said, when you're going to be in the clinic and treating a patient, do you want Dr. Mills, your PD there, or Danielle, the mom,
Mhm.
daughter, wife there?
Mhm.
You know,
Big
connecting
difference.
with the huge difference. Huge
That
difference.
I love that because that really kind of and it's kind of a I don't know how to say more like brave on your part move, right? Because in academics, at least my
Mhm.
experience in academics is everybody's always positioning for, the fancy, who has what degrees and what research projects and rarely do you put that aside and just step out into that and be like, "You know what? I'm a mom, I'm a daughter, I'm a wife, I'm a friend." And that's how you need to show up for your patients is like in that arena as opposed to a dictator, right? That's what you're saying, really, right?
Those are all different hats, right? They're all different hats that I wear as one person.
Mhm. It's
Go
fun,
ahead,
isn't it?
go ahead, don't do your homework. But now you don't treat one of my daughters correctly?
Mhm.
Yeah, we're gonna
Yeah.
have a convo.
We're gonna have a conversation about doing your due diligence and preparing. I mean,
Yes.
really, because
Yeah.
it is important, and the groundwork that you're setting for them is massive, and I can only imagine the experiences you've had, probably, in all jobs, good and bad, but the experiences within academia about changing things from status quo and trying to move those up. Can you speak a little bit about that? Like, as you've navigated that system to kind of put yourself in a position for change?
And I think that's where the neuroplasticity comes in, right? It's fancy word, sounding word, but it's really, are you adaptable? Are you willing to learn? And when students come in and it's my first interaction with them, I tell them, you need to be adaptable. You need to learn. You're coming with this experience from whatever your experience is, straight from high school. You've worked in a different field. You're coming in. You have to be willing to adapt and learn and grow
Yeah.
so that you can be the best clinician that you can be.
And it's about bringing all parts of yourself, really,
All
right?
parts.
Yeah. To like the forefront and not being afraid to be, for lack of better words, vulnerable with what you know and what you don't know.
It is.
Right? It's hard. Like, do you find that difficult in teaching? I know you probably don't teach as much as you used to, but
I don't teach in the classroom as much, but I am in front of other leaders and I do talk to them. I do an entire presentation for them on the neuroplasticity of leadership and being vulnerable and showing yourself grace. Because every time you may be an expert in your field, whatever that is, when you change to a new job or a new title, new position, you are now a novice and you have to show yourself grace in order to grow.
wow. I mean, it's so true. It does resonate. You weren't wrong. Totally, totally resonates with. So, like, how do you, like, in your presentations, like, are there key points that you found? Because you're in an elevated leadership position, right? You've been in leadership positions forever, captain in high school, captain of your, teams in college, and really you just have always just kind of stepped right in and, hey, what needs to get done? Okay, this is how we can get it done. And
Yes.
you've had to adapt along the way. So now that you're in this elevated leadership position, like, what are some traits you think that you've found to be common in what a really good leader looks like?
What I like to say is the shepherd should smell like the sheep. You have to be in there. You have to understand in order to understand what your direct reports and those that you're leading are going through, you have to understand what they're going through. And that's where the productive versus unproductive struggle comes in because you have to be able to recognize when that person, whether it's a direct report, a student, your child, is struggling and not getting the concept, getting the skill, and then not doing it for them, but then providing them the resources and the guidance to get them through to the other side. Because once they do get to the other side, it is an exceptional feeling of accomplishment for them and confidence building.
Hmm. Yeah, no, I agree. I've seen it. I see it in just in our clinical rotations and
Mhm.
different programs that we've run. I've had students that show up and they give every excuse in the book. Like, I had one young man gave every excuse in the book as to why he didn't get his homework done. And he was like, Andrea, you don't understand. I'm working two jobs and I have to do this. And I was like, I don't think you understand. I worked two jobs, played a sport in college, and went through one of the most difficult, programs, like collegiate programs as far as PT school goes. and you still have to get the work done. So adapting to that, but understanding the struggle but holding that line for them and not saying, "Oh, buddy, I'm so sorry. You don't have to do it." It's like, "Hey, buddy, I totally get it. I know it's really hard for you, but you still need to get it done. Can I help you figure out how to get it done?" That's what you're talking about essentially,
Yeah.
right?
Yeah.
Yeah.
Okay, why is this? Finding out, asking questions, observing. As physical therapists, our job is to observe. I tell the students it is my job to be nosy. So that's what I'm going to do. I'm going to watch you, in the common areas. I'm going to watch you interact with other students in the classroom. I'm going to observe. And honestly, I didn't realize this. Being organized and prioritizing yourself and what you need to get done is a skill.
Yeah, it's one I still haven't mastered. So,
So sometimes it is as simple as, I need you to walk me through your day. The time you get up in the morning, what are you doing? And I'm like, okay, um, this is what you need to do. 30 minutes after class, I need you to sit there. I need you to transpose all your notes into something that you understand. Because what's on that PowerPoint are my words, not yours. So it makes sense to me. It's got to make sense to you. Let's do this. And then being able to give them that critical feedback in time to reflect.
yeah, and I think it's easily you can easily transport what you're talking about with your students into work product, right? And like especially more fledgling companies. I mean, I've been in business for 9 years, but my staff went in a very short amount of time from like 13 employees to 31 employees in like the course of a few months, and trying to figure that stuff out, and how you speak to them, how you get your directives in order and whatnot was definitely a massive learning curve for me, around all the things you're talking about. Like, this is what I want, but are they consuming what I want them to consume from that, right? So
Yes.
are you hearing me? Like, I've learned to now say back, like, okay, this is what I want. Tell me what you heard. And it's fascinating to hear what is heard. I'm like, no, that's not at all what I was trying to say. Let me rephrase that. So it's, and I don't think enough people do that. I definitely didn't do that over the course of my early management, right?
Reframing of information and
All the time.
yes, and having them understand what the goal is. In my current role, I'm not always able to tell them what my ultimate goal is.
Okay.
So
Mm-hmm.
I need, right, because it may be not ready for
Flushing it out.
consumables
Right.
across different levels. And
Right.
so I will give them ultimately what I reframe what my supervisor gave me as a goal for them.
Okay.
Always thinking of the end, my end state and who the end user is.
Okay. No, I mean that helps. That makes sense. Like when you look at it that way, do you find that there's some like non-negotiables for you and how you operate for yourself? And the second part to that is when you're trying to frame graduating clinicians, are there like some basic non-negotiables that you like to lay down at least for your leadership team to make sure that you're instilling in your students?
Yes. I am very clear in what my expectations are, and I define what quality is
Mhm.
because that is not a universal
Right.
standard
Right.
what
Right.
quality is.
No.
Um,
And how
to
do you know if it's not?
yes, like I don't want misuse of capitalization. I know these all sound like silly things. With the students, I need you to make eye contact with me. Okay. So, first practical exam. They're so nervous. They're so nervous. So, I'm like, you guys have to meet individually and what I call review film. You need to review film with him. Hey, you did clearly did not prepare because you couldn't give me the instructions in a cohesive manner that a layperson could understand.
Mhm.
You didn't look me in the eye, and that makes me, lose confidence in you.
Mhm. Yeah, I mean, it's true. So, I mean, eye contact builds trust, and it
Okay.
like, it speaks self-confidence. If you can look somebody in the eye and say something to
Yes.
them directly, they "Oh, okay," as
Yeah.
opposed to, like, "Yeah, I think your shoulder might not be right," type
Yeah.
thing. Yeah.
Ignoring a patient, an employee that's crying, probably not
Yes.
great.
Probably not a good
Probably
trait.
not great. I give them what my strategies would be, and I'm
Mhm.
like, "You can try this, right? This is what works for me. If
Mhm.
it's not," I'm like, "I can take in lots of information.
Mhm.
You might need to do it in bite-sized chunks."
Mhm. Mhm.
Right?
Yeah, so, like, your behavior is not it's the standard for you, and it's
Correct.
something to aspire to for sure, and this is something that I wish the, younger people coming into our profession could embrace a little bit. You're not expected to be all the way up here. You're expected to be here, but have those basic functions, eye contact, good communication
Yes.
skills, empathy for the people you're taking care of, be a good team player, show up on time, be ready, all the things. And then you grow, like, like you're saying, emotional regulation and neuroplasticity. Like, how does that come into play for somebody that has limited life experience, like maybe 20 years, as opposed to 40 years? Like, obviously there's some sort of difference there.
There's definitely going to be a difference, and depending on even the area of where they got their experience might completely be different than mine.
Hmm.
And it's really first of all, helping them understand that life is all about learning. Even when you do have 20 years, 40 years, 50 years of experience, and just being observant. When you talk about emotional regulation, I had read about this one concept of command energy. And often, and I was like, God, that sounds very interesting. And what is that? And when we give in to our command energy, that is when we're not being very emotionally intelligent, and it's going to lead to failure. And having to review for yourself, okay, so what is my command energy? I can tell you
What
right now.
what does that mean? Command energy. Tell me what that
So
means.
giving in to your stresses, giving in to
Okay.
those items that really put you in a state of chaos and anxiety where you can't be a leader and you revert to having a fixed mindset.
Like survival mode, relying on what
Yes.
you knew
Yeah.
to be true from your past.
Yes, that's
Okay.
exactly it.
Mhm.
Mine is failure. And failure as I define failure.
Mhm.
And once I started, I'm like, "Oh god. Oh dear." Right? And I go back, I review film on what I thought was, maybe a bad interaction with a student or a colleague,
Okay.
and I'm like, "Oh dear. Yeah, definitely did give in to that command energy
Mhm.
and didn't realize that I had reached a state of unproductive struggle."
So, like, a
So
dysregulation of your emotions, and then it just like your filter was off, essentially.
oh,
Yeah.
yes. It was
The fi
off. It
yeah,
was
yeah.
off.
We all have them. My filter came off last week, so we
Right?
all have them.
I mean, we all reach that,
I
right?
mean,
Like, you came home 5 minutes later than you were supposed to. The oven didn't turn on, right? And now
yeah.
and it's like, to me, that's all failure. And I'm like, "Okay, deep breath."
Yep.
And actually, I started doing 2 deep breaths in before I exhale, and it really helps to center me and refocus on the goal.
I love that because I tell myself I have to take a beat. Like if something hits me the wrong way and I've started really, especially over the last 6 months, paying attention to where on my person I'm feeling some sort of way. It doesn't have to be
Mhm.
bad, it could be good or
Yeah.
stressed or whatever it is. And then I'm like, okay, why is that hitting? And just give yourself a minute before you respond in the moment. And I used to be, and still am at times, extremely hot headed. And I've really find myself like settling in through some adversity and stuff and just taking a step back, like always just stop, take a step back. And if it's not an emergent situation, I don't have to make any decisions right now. But I also don't want to non-filter destroy something in like
Mhm.
2 seconds that took years to build, like a relationship or like business relationship or colleagues or something like that. So yeah, no, it's like it's huge in
It is.
emotional, be able to emotionally regulate yourself.
And it's different, right? Depending, it changes from day to day. If, I had a great morning, worked out, ever got the kids out for school without incident, I,
Yay.
I can
That's a
take more
win.
hits. I can take more hits and be fine.
Hmm. But on the flip side, right? If your kids are screaming because whatever, or you ran out of milk for cereal and you forgot something and had to come back and like you're all backed up, you're probably primed for somebody to just like
Yes.
light that fuse and watch it go.
Yeah, for sure. And as leaders, whether we're talking in business or talking as an instructor, you're the leader of that class, we need to be able to support our students and our colleagues to persist through those challenges.
Hmm. And how would we do that? So so say somebody that is your direct report reports to you, and you just see like a change in their demeanor, maybe in a day or a couple days. Like, what does that say to you? And like, what's a solid approach that you've developed? And I understand it usually will depend on the person and the relationship you have, all the things, but just like general guidelines. Like, what are your thoughts?
One, again, I always prepare my students, my direct reports. I define what productive struggle is versus unproductive for them. And I make a point of observing my colleagues and my students in different situations. So then I can see that and recognize and be like, oh, like they just walked in this room with their head down. And I need to keep a better eye on them today in class because the smallest little struggle might cause them to quit. I present the problem to them and we discuss multiple solutions. And then I have them work out those solutions and then present them back to me. And then what I will do is, okay, well, what do you think? I like asking questions and I've gotten better at it through the years. Okay, what do you think? Play the devil's advocate right now. What's the possible negative implication of this solution?
Okay.
Okay, is that worth the risk? Yes or no?
So you walk it out for them, like you're
Yes.
walking with them
Yeah.
and walking it out.
I walk it through their solution to see what
Mhm.
that is for them. Uh,
Mhm.
I like to have them plan to practice the skill or the concept.
Mhm.
A lot of times, my direct reports, they have to present to the executive leadership. They don't do that on the day to day.
Right.
So
Right.
I provide them opportunities to practice
That's great.
and
Yeah.
then give them feedback. I'll be like,
Mhm.
okay, I'm playing so and so today. And then I kind of act like that.
Mhm.
Um,
So then you're able to recognize where there's a struggle and then give them options and ways really to work through that, but still letting them do the work, and you're
yeah,
not fixing the problem for them.
correct. And
Yeah,
then
that's a new concept for me in the last year, so
yeah,
it's
I
good.
recognize to them out loud the effort that they put in and and the grit that I saw them demonstrate while they were struggling. And like, you did this, right? You just did this. Everyone, like in a class, right? They're looking for the final practical, the final exam. I'm like, you got 100 on this homework assignment. You got all your muscle quizzes correct. Like, these
Be
aren't small things.
be
Like,
happy. Give yourself
you
a
you did
yeah.
this, right? You did your first evaluation, and it was great.
Yeah. No, that's I mean, it's I feel as I've gotten older too, it's never like if you're thinking good thoughts or you see something that somebody did well or you
Yeah,
appreciated, to start verbalizing it way more
yeah,
because I feel like it's super easy to be like, like, that's bad, stop doing this. And I fall into that too,
oh,
because that's the easy one, right? You can see it, it's not right, and you're like, what are you doing? But to
yeah,
equally bring about, I've always assumed that people know what's in my head, which also they don't. So the appreciative and positivity, you have no idea how you're going to make somebody's day that, like you said, you did an evaluation amazing. That's a
yeah,
big deal. That is
yeah.
a big deal.
Like, that patient just connected with you.
Yes, which is hard in this day and
Very
age. Yeah.
very hard. In approaching reframing to the positive, it 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 also is a skill, and approaching it as, "Yeah, that was a struggle, that was a speed bump, and now you're on the other side."
Now, would you say you've always had this approach, like
No,
in your teaching career?
no, I don't
Okay.
know. Because, in athletics, and I'm probably more framed by my athletics
Mhm.
career than anything,
Well, you're a
and
player's coach, really,
yeah, and
right? So you're a student's teacher, so to speak.
yes, but
Mhm.
you have to give the negative correction quick and fast because you have to make that adjustment immediately,
Mhm.
and that doesn't necessarily work throughout life.
Yeah, no, no. And not everybody's going to do that though. That's
No.
the other thing. And that's something that I wish I got more feedback. One, I wish I got more feedback early in my career, and two, I
Mhm.
wish I was more I was always curious. So I've known I've been a lifelong learner, like that's not a thing, but two, I was always afraid that I was the dumbest person in the room and that was something to be like ashamed or embarrassed about instead of reframing it as I have so much opportunity to learn, right?
Yes. Yes.
I know it
Yes.
it like blocks you out of things if you think that way.
Well, that's for sure a demonstration of a fixed mindset because you thought that what your abilities was in your product that you were producing was an inherent lack of ability, and that wasn't the case.
No, no, no,
That
no, and
wasn't the
then
case.
right. Right. And I think like knowing you for as long as I've known you and like the talks we had early in your teaching career is definitely you've definitely have made some transformations in how you approach things and as we all do, but the level of empathy for doing hard things but not letting people off the hook just because they're
Correct.
hard. And
Correct.
that's like I think that's huge lesson that if we can get that earlier in our careers that it will make navigating professional life so much so much easier.
For sure. And that's why fostering the growth mindset
Mhm.
allows individuals to kind of embrace this struggle and view it as this is a part of every learning process. It's not you as a leader, you as a PT, as an instructor. We make, because of our experience and because of all the struggles we had, we make it look effortless.
Yes.
It
Yes.
was not effortless.
Not for me. It was for you.
But the students in your direct reports, they
Mhm.
didn't get to experience that.
Yes, I know. So, like, how would you define productive struggle versus an unproductive struggle? I mean, I have something in my head that I think, but I'd like to hear it from you, like what your position is.
Sure. Productive struggle is when the task um, has been constructed or exists where it's just outside the bounds of someone's abilities.
Okay.
It's not much different than exercise progression.
Okay.
And that's where it kind of, right, you're not going to give someone, they're not going to be squatting 500 pounds. You're
Right.
not going to do that
Okay.
to someone,
Mhm.
right?
Yeah.
Because they're going to just quit.
So it's like a goal, right? Like an
Yeah.
attainable goal that
Incremental goals.
okay. Got it.
Recently, we've been, my my daughter has a spinal condition, and we needed to get her to be able to squat and get strong extensors. So we literally started off with the bar, weighs 15 pounds. We asked her, okay, what's your goal? Right? She's 12. What's your goal? I want to squat my body weight. Legitimately, within 10 weeks, she was squatting 105 pounds.
Oh wow.
I mean,
Yeah,
look,
girlfriend.
every time you added, right, weight to that bar, she's like, how much is that? How much am I doing now? And it it just spawns the desire to want to be more engaged and grow and grow and grow. Like, you did this, not me. Yes, I put the weight on the bar. Um, and now we have to get a rack because mommy can't put more
Spot
weight
you.
on the bar.
Mommy can't spot you anymore.
No more spotting. We're gonna have to go somewhere else. But
So
in
then so like same idea with the task management, I guess. Is that a good yeah.
yes,
Okay.
so
Got it.
you want the student. We have to memorize every muscle in the body. Do I give them all of them? No. I'm gonna give them, wrist and hand. Okay. Then we're gonna add, you know, elbow, shoulder, and you give them in incrementals, and then you keep challenging them, quizzing them, testing them in different ways. And then before you know it, I like to do it at the end of that class. And I tell my instructors now who teach the class, I said, now I want you to put the entire list up and show them how much they have learned.
That's awesome.
Right. And
Yeah, no. That visual alone is pretty awesome.
uh, it is very powerful.
Where you started here and now you're here.
Yeah. I mean, the same thing. A new clinician. You went from, I'm just going to say, 5 patients to
Mhm.
10 to this, right?
Mhm.
All of that. You facilitated this patient from going from not being able to participate in sports to now flourishing.
Mhm.
Turn to sport. Like, that
Yeah.
is a big deal.
I know, and a lot of us take it for granted
We do.
sometimes that we just do what we do. What's unproductive struggle? So for anybody that's trying to set these goals for their students and or colleagues or direct reports, like what would be an unproductive struggle?
So
Rewrite the
we
whole department?
yeah, right? Yeah. Okay, I'm gonna
Okay.
need you to schedule the patient, eval the patient, treat the patient, bill the patient, right?
Yeah. 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 Okay. Gotcha.
We're setting that goal outside of their capabilities.
Okay.
But we have to, as the leader, we have to recognize, okay, I gave them this goal. I need to take it back a notch.
Mhm.
It doesn't mean that they're not competent. I
Mhm.
have to take it back. I
Yeah.
have to reduce the size of the speed bump.
So
What's
you
the,
really have to know your people to some degree to be able
yes.
to facilitate a manageable growth factor.
Yeah. With my employees on every interview I do is, what kind of leader do you want and what kind of support do you need?
Okay, I like that.
And it usually catches them off guard,
Mhm.
but it helps me. One, I am not a micromanager and I can't do it. I'm very
Mhm.
bad at it. Very bad.
It's all right. Most people don't like it.
Right. But
Yeah.
some people, that's what they want.
Yeah, they wanna be spoon-fed a lot of things step by step by step. Mhm. I would agree with that.
But I asked them that. So I'm like,
Okay.
"Okay, we need to meet weekly for the first 60 days. Let's do that."
Okay. Yeah, no, I like that. I'm actually gonna apply that this week because I have, somebody that, just started working for us and just closed out the first 90 days, and,
Good.
I haven't given her as much time and attention as I should, and that makes it hard for her to do her job, and I owned up to that today, and we had a very productive conversation. We got a nice
Good.
meeting schedule set up, but it was one of those things that I was like, "Ooh, that's on me, big time." So, it happens to the best of us, but that, I just like to hear you talk about it in those terms. Like the last time we spoke, I think I saw you, well, we talk on the phone, but I saw you last year and we were just talking about like, the changes within your department and leadership and, how you like to run things. And it just struck me as like, yeah, there is a science behind this for sure. And adaptability is massive or you're going to be miserable pretty much.
Oh, definitely. If you can't adapt and if you
I was
can't,
I was just gonna say, what's your best advice for anybody in a leadership position right now?
they have to be adaptable and learn and under not learn, understand who each individual employee is. I don't
Yeah,
have the same. I don't I built a team so that all of our strengths, right, combine to be a good winning team. Right? You
yeah,
can't fill a team with just pitchers or
yeah,
just pitchers. Like
it's true.
that's not gonna work. You can have like most amazing pitchers and catchers, but you got other roles to fill.
Somebody's gotta play center field.
Someone's gotta do it.
No, I love that adaptability. That's awesome. Thank you so much. You're too smart for your own good sometimes, and, I really appreciate your insight. Can we do it again?
For sure, we could do it again. Thank you
Yeah.
for inviting me. It
No,
wasn't as scary as I thought it was gonna be.
it's an easy conversation. Thank you, Doctor Danielle Mills. How can people get in touch with you if they have questions or want to learn more about the work you do?
Sure. They can get a hold of me at dmills at carrington.edu.
That's awesome. Thank you, Danielle. We
Thank
will,
you.
for everybody else, I'll see you next time and have a good night.